Shatera.
Hi, I'm Shakira.
Hello, I'm Izati.
Hi, I am Azalia. This is Fazli and this is Mani.
To understand albinism, first you need to know what is melanin. Melanin is a chemical in our bodies that give color to our skin, hair, and eyes. Albinism is a congenital disorder characterized by the complete or partial absence of pigment in the skin, hair, and eyes due to the absence of defect of tyrosinase enzyme that involved in the production of melanin.
Okay, next we about the etiology of albinism. For those who has albinism, they usually get this type of disorder by two factors, which are genetic inheritance and also the absence of certain enzymes. How albinism is inherited? Albinism is inherited by two patterns, which are autosomal recessive inheritance pattern and also by X-linked inheritance pattern. Autosomal recessive inheritance pattern occurs in most cases where albinism is passed on from the mother to the child. However, some type of albinism caused by the X-linked inheritance pattern where there is mutation on the X chromosome. Besides genetic inheritance, the absence of certain enzymes such as phenylalanine hydrolase and also tyrosinase in the process of degradation of phenylalanine can also cause albinism. If there is no such enzyme, therefore the whole process will stop and no melanin will produce, and this will cause albino characteristics to appear.
Okay, now let's referring to the melanin chemical pathway. In this melanin chemical pathway, tyrosinase enzyme is very important in the production of melanin pigment. In this melanin chemical pathway also, we can see tyrosinase enzyme has a responsible in converting tyrosine to dopa and dopa to dopaquinone. Dopaquinone later will form eumelanin and puremelanin. Then alteration in this tyrosinase enzyme will cause albinism. However, we have two additional enzymes, which is tyrosinase related protein 1 and tyrosinase related protein 2. Alteration in the tyrosinase related protein 1 will cause albinism, while alteration in the tyrosinase related protein 2 will not produce albinism.
For pathophysiology, it is because of the lack of melanin pigment. The tyrosinase gene provides instruction for making an enzyme called tyrosinase. This enzyme is located in melanocytes, which are specialized cells that produce a pigment called melanin. Tyrosinase will convert a protein building block to another compound called dopaquinone. People with albinism are very pale with fair hair and very light eyes.
The sign and symptom of the albinisms. From the skin color, we can see the skin coloring, which is the pigmentations, range from white to brown or maybe nearly same as that of family members without albinisms. The patient will get patchy skin, and then some patients will develop freckles, most with or without pigment and ability of the skin to tan. Besides, there will be absence of hair color lighter than normal or range from very white to brown. African or Asian descent have yellow, reddish or brown hair and may also darken by early adulthood. From the eye color, it ranges from light blue to brown color and may change with the age. The lack of the pigment in colored parts of the eyes, which is the iris, makes them somewhat translucent. From the eye vision, there will be nystagmus, strabismus, farsightness, nearsightedness, photophobia, which is the sensitivity to the light, astigmatism, which causes blurred vision and the vision problems. The diagnosis test that can be used to test the albinism is physical exams, description of the pigment changes, true exam of the eyes, comparisons of the child's eye with the family members, genetic testing, appearances of the skin, hair and eye color using electroretinogram, which is a test that reveals the vision problems, and lastly a simple test that measures the brainwave to show misrouted optical nerves.
Okay, now we go to how to treat the albinism. The treatment for the albinism depends on the severity of the symptom. And as for now, there is no cure for the albinism, and those treatment is just to relieve the discomfort and reduce the symptom. The example of the treatment is protect the skin from the sun, prescription glass recommended, use bifocal glasses for young children, and use dark glasses for photophobia. That's all from us.
Thank you for watching.